Well, welcome and thank you for joining us as we discuss Hispanic Heritage Month, the value and the opportunity that lies within this opportunity of people. My name is Joe Orsini. I'm president of Network Insurance in Grupo Latinoamericano de Seguros. I'm joined today with two of my illustrious co-workers. Anna Hernandez is our managing director. Mal Varlick is one of our team leaders and marketers within our organization. So I think we should kind of get right into it. You're talking about the opportunity within this population. I think we should establish what's the size of this population. So Anna, what type of group are we talking about?
Well, it is a very large group, actually. As of July of 2024, there was 68.1 million Americans, Hispanic Americans. Obviously, that includes about 3 million in the U.S. and the descendants of 10 million Puerto Rican descendants in the U.S. So that makes us the largest ethnic minority in the United States.
Yeah, so it's a massive.
It's massive. Yes, a massive opportunity.
But when you dig down even one level lower, how many different ethnicities go into the term Hispanic? Is
that's
20, 25?
Yeah, that's a great question because everybody kind of bunches into each other, and it really is not. There's a diversity within the Hispanic community. So Latin Americans, Central Americans, people from the Caribbean, and something that we need to be aware of when we talk to these people.
Yeah, certainly. So I appreciate that. And Mal, I'm going to turn it over to you for a second. So why is it so important to serve the Hispanic community, and what makes this service unique compared to other minority populations?
Sure. Very good question. Number one, there's obviously the language barrier. And because there's the language barrier, anytime that there's a language barrier, the second thing that comes up is going to be some type of mistrust, misconception, confusion, things along those natures. And so with insurance, it bridges that gap that says, I don't understand, I'm confused, I think this is the way it is, but with us reaching agents and agencies, they can go out and say, hey, no, this is what the product does, this is what it's going to do, this is what it's not going to do. And it destroys those cycles of fear and misinformation and all those other things. Thirdly, it's what we call economic justice. We want to bring the same resources, the same opportunities so that the Hispanic community can live the same life as everyone else in this country. And so it's very important for us to be able to get that out to the agents and agencies, and so that they also reach their communities. The other thing that we also do and we also understand is that in our particular culture, and I'm not saying it's the only culture that does it, when I was growing up, it was the norm to get a phone call from the Dominican Republic, and they would ask for money because the expectation was, okay, you're here and now you're, fruitful, or, you're making more and you're growing, but don't forget us. Remember where you came from. And so one of the things about this, serving the Hispanic community, is using life insurance, annuities, health insurance. With respect to insurance, yes, if you are in a different country, maybe you can't be the beneficiary, but certainly you could set it up in a will where it says, if this were to happen to me, send money back home to this person, that person. So it's actually a type of service and a type of honoring our loved ones who are back home. So it's very important that we serve not only as agents and agencies, but those that we love back home who haven't left and obviously don't have the same opportunities that we now have.
Yeah. That's a great point. Anna, I don't know if you had anything to add to that or
yeah, actually, from the bottom line perspective and from the business perspective, we understand that by getting these people insured, making sure they have health insurance, right, and they're being proactively taken care of, is going to reduce the cost of care for the insurance companies or for the country, for the Medicare system. Because if you have somebody that has health insurance and is being proactive about taking care of their health, that's going to reduce high blood pressure medication, cholesterol medication. All of that is a lot cheaper than having somebody end up in a specialist office or even in the hospital. So from the business perspective, it is very smart for us to go and help this community get health insurance.
Absolutely. So we definitely agree that it's underserved and there's some uniqueness that we need to take into account
Yeah.
as we're
Absolutely.
working in this population.
Yeah, they don't get that much information, or if they receive the information, they not might be, especially the elderly, might not be fully bilingual. So we need to, that is a responsibility, not only from the human perspective, but from the business perspective,
Certainly.
that
Yeah.
we need to service them.
Great point. So looking forward in the time frame that we're in, where AEP is fast approaching us, and we've discussed this at length, and this is definitely going to be one of the more tumultuous AEPs that we have. I like to call it the storm before the calm. Hopefully, is how it goes. So Mal, looking at that at Grupo, what are we doing to make sure that our agents are prepared for AEP and prepared to serve this community, touching on all that uniqueness that we just discussed?
Sure. So one of the first things that we have done is we've established a Grupo University. In that university, there are Medicare plans. There's really customized training on what you want to learn. And it's free.
How much does it cost?
It's free. But
Yeah.
they have the ability to go in and at their leisure, at their however easy it is for them to understand at their own time, to go in and learn. And if they have questions, guess what? They can pick up the phone. They're not going to get an answering machine. They're going to get a live marketer, their own marketer. And we do one-on-one trainings, and we do it throughout the year. We just don't start, it's July, and okay, AAP's coming up. We do one-on-one trainings daily, it seems like. We're always on the phone. Secondly, we've established on Wednesdays Grupo briefings. It's a half hour, and we go over industry news, what's going on in the industry, because a lot of times agents are so busy, they miss things. And these things, everything's important. So we do the Grupo briefings, we have one-on-ones, and we have a Grupo University that they can go to at their leisure. And most agents, or I would say darn near all of our agents, in one way, shape, or form, take advantage of one, if not all of them. And we love it because we know we can't stop doing it, and it only causes us to get better and better and better and better. So that's what we have going on. And we do it every day, not just when AEP is about to come around the corner.
It sounds like a lot. You look
Yeah.
so calm as you were talking about going through this and dealing with it. So, no, I appreciate it. I know the efforts are incredible, and the offering is
Yeah.
something to brag about and be proud of.
We work all year round, and the best part about the university is that allows the agents to have a holistic view of the client's needs, right? Not just the health insurance, but we help them with the life insurance. We help them prepare for retirement with annuities, with everything else that they need to have a solid retirement. So, but yeah, absolutely, we want to make sure that people know that we are there all year round for our agencies and our agents.
That's a great point, because this is not just
It's not an
a
AP
2-month
effort.
endeavor. It
Yes.
is year round, and it
Absolutely.
is stressful, and that's what we're here for, is to help
Yes.
with it. So it's continuing to talk about AEP, and again, all the service area reductions, the non-commissionables, all
Yeah.
these headwinds that we're facing. Anna, do you foresee any type of downturn this AEP in the Hispanic market?
Au contraire. Absolutely not. I think that if anything else, this year is going to can possibly be the best AEP the agents can have. Have you ever heard the saying that in troubled waters is fisherman profit? Well, when the markets are like this, like what you mentioned, with the service disruptions, with plants closing altogether, and a lot of these clients are not being crosswalked to another plan. So more than ever, having agents, having professionals help them, guide them through that process is going to be amazingly important. Not only, important for the affiliates and, very profitable for the agents and the agencies. And earlier when you asked me about how many million people, well, out of the 68.1 million Hispanics, there's over 5 million people that qualify for Medicare. So there's a lot of opportunity. I can assure you that half of those people, or even more than that, they will need help this year. And that's where we come in, right? That's where
Absolutely.
Grupo Latinoamericano and Grupo Latinoamericano de Puerto Rico, we are ready. We are ready. We're here to help. We've been preparing for past 12 months. It's not just doesn't started when AHIP came out. No, we've been doing this year round. So we are here to help them.
Awesome. Love to hear that. And au contraire, I love it. So real
Yes.
quick before we wrap up, any last piece of advice that you'd like to share with our audience? Mal, we'll let you put you on the spot and let you go first.
It's basically touching off of Anna's point. We know that a lot of times, okay, there's headwinds and things just that aren't going what we think should be in the right direction, and it becomes a distraction rather than an opportunity. So this year, rather than any other year before, there is more, to her point, more opportunity than we think. It's just that we have to get out of that mindset that, the rain is coming down on us only. It's not. It's just another way to look at the sun is actually shining, and you can actually take advantage and use that opportunity to help your business grow.
Agreed. Great point.
Yeah. Cross-selling, 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 cross-selling. This is the year that if you haven't understood what holistic view means or cross-selling does, this is the year that they really need to go out and practice it. Everybody is, seriously, most everybody will need a hospital indemnity plan, right? Everybody is going to need something to complement, the PDPs, the other plans, all of the changes. We need adjustment. So we don't have a moment to sit back and worry about changing. What is changing? Well, you got to learn what the opportunities are, right? And not just the Medicare market and all of the markets. So I think adjusting, and you know that one of my favorite things is, and I love when AmeriLife came up with the team with the chameleon, because you had to adjust and you had to be flexible. My favorite book is Who Moved My Cheese? So I think that this is it. This is the 1 year. Every year we hear disruption. Every year. 3 years ago it was the recordings. Last year was compliance. This year is changes to the plans. But every year we go up there and we make it happen, because there are people that need us, they need our advice, and specifically, especially the Hispanic community that get the material and sometimes they don't understand it. So I will view this as an amazing opportunity year for our agencies and our agents.
I agree. I think, as you mentioned earlier, troubling waters,
Yep.
fishermen prosper.
Yep.
I think this is the year for that. So make sure you're educated, make sure you have a plan, and take the time to, before AEP gets here, to be ready and to address your existing clients. How are you going to grow your book of business? And if you have any questions, please use us as a resource. Let us help you along the way. So appreciate everyone's time today. Thank you for joining us. And if you have any questions, let us know.